Hey everyone, we've got Dr. Patricia Bradley here with us today. She's Professor Emeritus at the School of Nursing at York University, and she's going to be talking to us about incivility in the workplace, bullying, and burnout. We know this happens. Stay with us. Hey everybody, welcome to our podcast, The Naked Truth of Healthcare. I'm here with my guest today, Dr. Patricia Bradley, and Dr. Bradley has extensive teaching experience in Canada and the United States. She has taught in university, colleges, and healthcare settings. Pat is currently the Professor Emeritus in the School of Nursing at York University. She has developed and delivered nursing and interprofessional workshops on best practices in education to healthcare educators and providers. And she has given workshops and presented at conferences on incivility, which is the topic we're going to get into today with Dr. Bradley. And we're going to explore some insights that she can share with us and also ask her some questions. So, Dr. Bradley, welcome. And I'm going to call you Pat, if that's okay with you.
I'm more comfortable with that. Thank you.
Hey, you're welcome. You're welcome. So, Pat, I know that anyone listening, they've heard the word incivility. They're probably jumping all over it and going, oh, I've got to know more. But I'm going to start us off with, you've done a lot of work around incivility in the health professions. Can you fill me and the audience in on why? What drives you and the research in this area? What's your story around this area and why you're pursuing it and why you feel it's really
Mhm.
relevant?
Well, and I do believe it's relevant. And one of the things, which is a little on the side, but I'll come back, incivility even has many definitions, and some people use other words like horizontal, vertical violence, microaggression. Some people don't like the word micro attached to it.
Right.
There's so many words, and so even when you are finding and looking for information, it may be defined differently. So, so incivility is what we're talking about today, and I think that we're looking at a broad approach to what incivility is. I became interested, um, I would say iteratively, in that, okay, what's going on here? Um, this doesn't seem to be what healthcare is about. What is this? And it needs to be better. And when I think of healthcare, notice the word care is about care, then that idea of incivility does not fit. Now, a surprise to me, so I started research on incivility, and because I was very interested in internationally educated nurses and their experiences, that expanded it also into their experiences. When I have given a workshop, I even attended a conference. I asked everybody who was a nurse to stand up, and I said, who has not experienced incivility, sit down. One person sat down. It was a room of like a couple of hundred. And then I went up to see that person later and I said, "Oh, that's interesting me that you haven't experienced it." And the person said, "I'm not a nurse." So that was very powerful. Now, you would think because I have really looked at this, thought about this, read about it, done research on it, and then only the other day, I was thinking, you know, you've experienced this yourself. Okay, I'm a mature woman. I'll just call it mature of a certain age. And I never really considered that I had experienced incivility. I always thought I was thinking about it and other people and helping how to support and how to prevent it from happening. But yet, when I look at my past, I can give numerous examples in numerous ways, and I never really reported it. That is part of the incivility discussion, is the silence around it.
Right. Okay. Um, okay, what I'm hearing then is that incivility, whether it's, and I'm going to use the terms bullying,
Yep.
harassment, scapegoating, belittling, microaggressions, etc., in healthcare workplaces are almost the norm. it's like it's the norm of how people behave towards each other. It's become accepted, I don't know if it's become accepted, um, but it's carried from workplace to workplace as well. And there seems to be an acceptance of how people behave.
Mhm.
Um, and that it's just how we behave. This is how we act towards each other. Because when you said everybody stood up, if everyone's experiencing it, there must be some kind of acceptance of it. So, and you've also seen, can we go to your research for a minute? You've also seen research to support these kinds of observations. I mean, am I going down the right path here to saying there is acceptance and research is supporting that?
Well, I think research is reporting the incidence is quite high. And we're talking healthcare in general. So if you look up, for example, internationally educated physicians,
Yeah.
there's a high percentage of people, international physicians, experiencing that. If you look up internationally educated nurses, you see a high percentage. When you look up nurses, you look at students in nursing, the percentage is, it can vary, but it is a very high percentage. But I wanted to also speak to the acceptance part because the research says it's there. It needs to change. But having done a presentation one time again at a fairly large conference, I had someone and more than one stand up and say to me, nurses eat their young. That's just what it is. We need to get over it. And then I also had comments about we are an oppressed group, we are protecting ourselves. So that I believe is, and it's not saying it's true, not true, but I don't think it is giving permission for continuing this kind of environment.
Um, but people are also accepting what they're the incivility, the bullying,
Mhm.
harassment, and I can't help but feel there's perhaps a sense of shame around it in terms of reporting it.
I
Um,
believe there is
yeah, and
because because I think that there's the shame within the person and they don't talk about it. When I told you my example of I never really labeled what I experienced as incivility, why wouldn't I have told anybody? I've had students who maybe told me months later of what a patient said to them. Do you see? And so there is that shame factor, embarrassment factor. Um, and then, part of this experience is there is between the person who is being in civil and then the receiver, but there's also the observer.
yeah,
And I did have, for example, a student who did her master's thesis looking at the observer. And the part of the observer is fear that they will be next if they call them out. Do you know what I mean? Relief that it's not them. But they seem to then provide support after the event. Maybe go and speak to the person who was treated that way and offer support. But in the moment, there isn't always an addressing of it. And part of it is, I think, a skill development. Do you know what I mean? Like, what words can I say? And I do think it's important. Um, and it shows not accepting it that you have a few little phrases you can put in your back pocket to pull out if somebody says that to you or you see somebody else saying it. So it is about, because then that shows non-acceptance. But I do think the shame and vulnerability is significant. And also, we do recognize that incivility can be hierarchical. That person has more experience than me, um, is a higher, what they are conceived as being higher professionally. I'm not saying they are, but so it is that, and also there's shame, and it means I'm weak. they're picking that out, and um, pointing out how and some of because I've worked so much with internationally educated nurses, and they don't come out with this right away either. They're keeping it quiet. So some patients, again, because we're talking about across all, some patients can say to, for example, a nurse um, who has an accent, "Well, are you really a nurse? Where are you from anyway? I want a real nurse." That statement there is a true anecdotal, I'll say, example that I have heard many times. And so that's not respectful. So, how do you handle it when it's a patient? How do you handle it when it's another nurse that you're working with? How do you handle it with another healthcare professional? How do you, even at an organizational level? So, it really um, takes thoughtful reflection, reflecting during the time, you're reflecting when you look back, but most importantly, reflecting in the future, what am I going to do?
So,
But I don't want to sound like I'm blaming it on the person who's on the receiving end, because
right.
really the fixing
Yeah.
is really focusing on organizations and systems that create healthy, safe environments for everybody.
So, can I take you back to something you said a little earlier? It sounded like there was this behind the scenes support, and I just wanted to sort of draw a picture of this is all going on in the environment, but there are these hidden support systems that colleagues are giving to each other, not necessarily facing the bully or
Yeah,
facing incivility head on. There is a system of behind the scenes support.
yeah,
Got a cluster of friends or people that will empathize
yeah.
with you because they've observed it, but no one feels empowered to actually face it, but they're giving each other support behind the scenes.
And that's not all the time, but it does exist. But how do we help that person who is the observer move forward in the moment and speak out? Um, I mean, I think it's helpful for the person who received this behavior and civil to have a colleague support them, right? However, in the moment, but I can appreciate that the person who is the observer is thinking, I could be next. So I
Yeah.
think that that's um, a fear factor, because I'll say that, you know, um, people who are in civil probably are pretty consistent being in civil. That's a general statement. Do you know what I mean? You've got a skill level that you can
Yeah.
say that. And it can be interpreted from the deliverer
Right.
that it shows that I really care
Okay.
because I want it to go well and I need to
Right.
fix you.
Right. Okay. I'm going to again help us sort of paint a picture of what's going on in this dynamic. So a person that is the perpetrating the incivility, the bullying, the harassment, could also have been a victim of it themselves.
Absolutely.
Yeah. But they're now perpetuating it because they have observed, I don't want to get into the psychology of this. I don't mean to, but maybe they've just observed this is the way things get done or things are done.
The
Uh,
norm, the norm.
Norm, exactly.
And that is what needs to break, that is not the norm for everybody, because it does have a major influence, right, on healthcare delivery, on mental health, physical health, the organization being able to retain nurses, for example, retention, um, the quality of work, all kinds of, there is a big influence, and that's why it can't be ignored, um, big picture, but it can't be ignored little picture, because that person who is going home hurt and worried. And the other thing too is you don't want the person who has experienced that incivility to then hide. That's not safe either.
Yeah. Um, I'm hearing you hint at a number of things that are the consequence of all of this. I'm going to focus still in on the individual or the people
Yeah,
first. um, consequence of maybe they're not going to show up for work because it's harmful and it just builds and it builds and these kind of microaggressions, they just build. Um, maybe they will not feel well and they're not showing up for work as much.
Mm-hmm.
And
Quit. They quit.
they quit. Yeah, they quit. And that's such a big impact on a person who just wants a career.
Mm-hmm.
It's
Mm-hmm.
something they studied for and they got licensed for. They spent a lot of time and energy doing, and presumably they're doing it because they love it.
Mm-hmm.
Now they're having this kind of impact on them that is forcing them to perhaps do things that they never expected they would need to do, like potentially leave this job or maybe even
Mm-hmm.
change
Mm-hmm.
careers. Um, and it's going to lead me into my next question. It's I don't want to blame at anyone's feet. But there's a larger system that exists around these people who are there to do their job. The management, the organization they work for, the regulator, the funder. If it's healthcare, it's like there's a funder involved. So you would think the responsibility needs to be diffused amongst those people. Not sure what maybe the research says about this.
But
Um,
there are policies.
okay.
Healthcare institutions have policies and procedures on how it, but again, it's the reporting.
Getting people to say something.
Yes, saying it. And I'm going to go back to your microaggression word because even though some people don't like the word micro because it means it's small and it's not important, but
Okay.
microaggression often means that subtlety. Okay, okay, Tanya, talk to me.
Right, right. And I'm going,
Okay. So
um,
how do you report that? Do you know do you know how do you figure out a way of how to deal with it? Do you know what I mean? So there are ways people can use humor, um, uh, exclusion.
yeah,
They're not part of the discussion. Like there's ways that are kind of, oh, you're just being too sensitive, Tanya, just too sensitive. Get over yourself. Do
yeah.
you see what I mean? Well, that's not very respectful to say that to you,
Mhm.
right? You
Very
know?
true, very true. It's the subtlety of the comment can be an acceptable way to talk to another person.
Hmm.
It's
Hmm.
like and pushing, and then in effect pushes the blame back on the victim
Hmm.
here. It's
Yeah.
your problem.
So
It's not
the
mine. It's
organization has to have policies, procedures in place that are strong, but they also need to be the people, the observer, the person on the receiving end, and the one delivering it. All of them need, it isn't just, oh, we got a policy. It has to be, okay, how do we deal with this? What is the actions? What is the activity? You know?
yeah.
And I think it's also tricky when you're talking about patients, clients, like if they're being racist, abusive, sexually inappropriate. I had a student who told me months and months later how a patient was sexually inappropriate to her. Never said anything. Now, and I don't think I'm too scary, but that was a shame, embarrassed. I don't need to talk about it.
I mean, there's so it's
And they
going.
don't tell their teachers either.
Let's
So
say,
the educators are part of this too, right? So when the literature that's on, for example, I'm going to go back to nursing education, there are many examples and statistics and research to show that nursing students experience incivility microaggression from patients, other nurses. Well, you don't know much anyway, kind of stuff. Educators, so there's,
a lot of
so
people
it's,
involved in this story.
yeah, so it isn't just one group, and it is um, that's why it's complex. And so if it's starting in education when you're learning to be, that's not good.
Thanks, everyone. Don't forget to like, subscribe, and share, and join us for part 2.